you look at kind of the landscape of integrative medicine and healthcare right now, and we're going to get into some details around the healthcare industry because I know you teach the healthcare leadership, mindful leadership specialization, but I am curious where you see things headed in terms of integrative medicine and health, because you were on the really ground floor with massage therapy. You've seen it evolve. What's happening, churning right now in this space as it relates to mind-body medicine, et cetera?
Nathan, that's an excellent question, and it's one that we continue to ask ourselves. And because it's a scholarship-based program, I monitor the research every day. I'm watching to see what's going on in research, but I'm also active in practice. So I stay involved with what's going on a practice level. So for an example, 10 years ago, integrative medicine was not a term. We talked about what I'm doing and what we're teaching is CAM, complementary and alternative medicine. So NIH changed that. They changed the terminology, and the words we use are powerful. We believe that, right? Because we're scholars. So it's the way that we write things, the way we talk about things, and the system, because I see this very much as a system of healthcare delivery and healthcare consumption and healthcare promotion, as well as healthcare as an aspect of mind, body, spirit. So what's happened over the last few years in integrative healthcare has been really interesting. Up until about 3 years ago, I think we'd all anticipated that integrative medicine had an opportunity that came out of the opioid crisis.
Mm.
And that, in large part, is because there was a turn away from pharmacological interventions because, in many cases, they just were not working. And we have seen repeated cases of trauma. For example, the U.S. military is one of the largest consumers of integrative healthcare to this day. The VA system has been instrumental in very different places across the country in introducing different practices. So initially we were looking at things like massage therapy or chiropractic or acupuncturist components. And now we have a better understanding that it's an entire system that is what can be part of the movement to changing the way we deliver and experience healthcare.